The Active Hospitals pilot started in February 2018. So we've been developing it since then over the last couple of years. The pilot was funded through Public Health England, and the aim was to embed physical activity across clinical pathways in a secondary care setting. Obviously, there's a few different big challenges to overcome. One is about trying to get that high-level leadership on board with the physical activity agenda. And again, thankfully, Oxford is a very innovative trust and a trust that's very forward-thinking, and they have developed a prevention strategy, which we've been helping to input into. Another challenge is thinking about the systems, so changing systems within healthcare. Obviously, in a big organization like this, there are big systems, and to actually influence that and change it is really important, because that's what then carries over into patient care. One of the things that Public Health England wanted from this pilot in Oxford was that we could learn from what went well, what went less well here, and then apply that in other hospitals going forward. We have produced a toolkit which will be online, which really goes through what we did in Oxford, how we did it, what things we learned, what things went well and what went less well. And we'll be providing lots of resources and the tools and things that we developed that will help other hospitals and other healthcare professionals get going quicker. I think that physical activity wasn't widely discussed routinely. However, that doesn't mean that it wasn't discussed at all. What we did to try and understand this problem a bit better was we conducted insight interviews with healthcare professionals across the Oxford Trust, across different clinical settings and different grades and staff. And the idea was that we wanted to learn from them what the barriers and motivators were that would enable them to actually be able to have these conversations better. We've put a lot of this learning on our toolkit, which will be available in the future. And we've also put a guide of how you can do your own insight work into the toolkit so that people can do that with their own staff. I think that's it was variable how long it took for the changes to be embedded. One thing that made a major difference in the maternity pathway was the introduction of the physical activity calculator as a mandated part of the assessment. So therefore, going alongside that, a training program for all the midwives, we were able to get things up and running and change the behaviour of healthcare professionals quite quickly. I think that the Active Hospitals project has had a huge impact on the patient care across the different pathways we've been involved in. There's been lots of really positive and inspiring individual stories from patients. In our cardiology pathway, where we had motivational interviews with patients undergoing the TAVI procedure, we've now got some preliminary data showing that these patients increase their physical activity levels after this intervention, which is very cost effective. I think that's a real positive. Well, we know that physical activity is really important in the management of long-term conditions and in the prevention of long-term conditions and diseases. And there's a huge range of evidence that shows that. A lot of that can be found on the Moving Medicine website. And physical activity has also got a huge impact, not just on physical conditions, but also mental health as well. I think there are a lot of great resources out there that healthcare professionals can go and look for and use. So Public Health England has many resources. eLearning for Health have just launched some new resources about physical activity. And the BMJ Learning also have some interesting resources that can be very useful. The physical activity agenda is really increasing its momentum at the moment. This is particularly true because of the NHS long-term plan. The Oxford Trust has moved on its prevention agenda and is developing a prevention strategy, which I think is going to be vital for us to embed physical activity within this trust and hopefully across the whole of the NHS going forward.